Everyone, how are you? Welcome to another question and answer session. A 23 years old woman admitted with severe pyelonephritis and associated with perinephric abscess. During attempted to percutaneous drainage, he developed hypotension, tachycardia. Of the physiological changes described below, which is not typically associated with such event. So, in this condition, a 23 years female present with severe pyelonephritis and perinephric abscess. But during the percutaneous drainage, he suddenly developed hypotension and tachycardia. So, we have to find out which event will not occur. Here the options are increased cardiac output, increased systemic vascular resistance, oliguria, systemic cytokine release, and tachycardia. So we have to find out one of the option which will not occur in this condition. So here, as this is the infection, that means the severe pyelonephritis and perinephric abscess, so there is chance of development of the septic shock. And here, first of all, we have to know details about the septic shock. We know that in the septic shock, the septic material, that means the inflammatory cytokines, they are released into the blood and they causes dilation of the all blood vessel. So the dilation of the all blood vessel, that means they causes dilatation of the artery and they causes dilatation of the vein. So artery, vein, all are dilated. For this condition, blood pressure or systemic vascular pressure will reduce. Similar response may occur in anaphylactic shock. So the anaphylactic shock, this patient may also have anaphylactic shock also, because the pyogenic substances, they are usually confined, that means around the kidney, but suddenly they are released in the blood, and also in the neurogenic shock. And here we can see the systemic vascular resistance will reduce as the blood pressure or blood volume reduce or the vascular tone reduce. Increase heart rate usually increase, normal or increase cardiac output usually increase, and decrease blood pressure. So any type of septic shock, usually blood pressure reduce, cardiac output increase, but blood pressure reduce, systemic vascular resistance reduce. So in the septic shock, systemic vascular resistance reduce. Why reduce? Because the inflammatory substances or cytokines, it causes or it blocks the capacity of the vessel, and it reduces tone of the artery and tone of the vein. For this condition, systemic vascular resistance reduce. For this region, vasopressor or noradrenaline may be used. So vasopressor and noradrenaline may use to increase the vascular tone, or that means the increase the tone of the artery or tone of the vein. Hypotension and oliguria is present in the septic shock because there is less amount of fluid present in the kidney, less amount of cardiac output reached in the kidney. And in this condition, intravenous fluid introduced. And here we can see this is the septic shock sequence. First of all, bacteremia, that means the bacteria enters in the blood. Then SIRS, that means the systemic inflammatory response symptom develop because the cytokines released in the blood. Then sepsis occur, and when there is severe sepsis, then organ dysfunction. Actually, it is the multi-organ function. When there is dysfunction, when there is multi-organ dysfunction, there is death. So here our option in case of the septic shock. In case of septic shock, here we can see the systemic vascular resistance, it will reduce, not increase, it is reduce. So which is least likely or not typically present? This increase. It is not increase, it is the decrease. Increase cardiac output. In case of septic shock, cardiac output increase. So it is true. Oliguria may occur, it is also true. Systemic cytokine release, it is true. And the systemic cytokine, it reduce the systemic vascular resistance, and tachycardia also develop.